If you wake up every morning with that familiar burning, shooting, or aching pain running from your lower back down through your leg, I want you to stay right where you are. Do not get out of bed yet, because what you do in the first 5 to 10 minutes after you wake up, before your feet even touch the floor, can either significantly reduce your sciatica pain for the rest of the day or make it dramatically worse. Most people with sciatica wake up and immediately swing their legs over the side of the bed and stand up. They grab their coffee, they start moving around, and within minutes that sciatic nerve is already firing, already irritated, already setting the tone for another painful day. What I am going to show you today is different. I am going to give you 5 specific exercises that you do right there in your bed before you get up, before you put any load on your spine, before gravity starts compressing the structures around your sciatic nerve. These exercises are specifically designed for sciatica, not general back pain, not general stiffness, sciatica specifically. They are designed to decompress the nerve, reduce the inflammation around it, restore its ability to glide freely, and prepare your spine to handle the demands of the day without triggering a pain flare. Every single exercise in this routine can be done lying in your bed right now. No floor, no mat, no getting up and down. Just you, your bed, and 5 minutes that are going to change how your sciatica feels every single morning. Let's get into it. Before I show you the exercises, I want to take 2 minutes to explain why the morning specifically is such a critical window for sciatica management. Because once you understand this, everything else is going to make perfect sense. Here is what happens inside your body overnight while you sleep. Your sciatic nerve, the largest nerve in your body, runs from your lower back through your buttock and all the way down your leg to your foot. When it is being compressed by a herniated disc, a narrowed spinal canal, or a tight piriformis muscle, it spends the entire night in that compressed position, 6, 7, 8 hours of continuous compression. And during that time, the inflammatory chemicals that cause the burning and shooting pain accumulate around the compressed area. The muscles surrounding the irritated nerve tighten protectively. The nerve itself loses some of its ability to glide freely through the surrounding tissues. And then when you wake up and immediately stand up and start moving, you are asking that compressed, inflamed, stiff nerve to suddenly handle the full load of your body weight. Gravity compresses your discs, your spine takes on load, and that already irritated nerve is now being compressed even more aggressively than it was overnight. This is why so many sciatica sufferers find that their first hour of the morning is their worst. The combination of overnight inflammatory accumulation and the sudden addition of gravitational load creates a perfect storm of nerve irritation. The solution is to prepare the nerve before you stand up, to reduce the inflammatory buildup, restore nerve mobility, and gently decompress the structures around the sciatic nerve while you are still lying down and your spine is still unloaded. That is exactly what these 5 exercises do, and the order in which I am going to give them to you matters. Start with exercise 1 and work through them in sequence every single morning. Exercise 1. Supine sciatic nerve floss. The first exercise targets the sciatic nerve directly. It is a mobilization technique specifically designed to restore the nerve's ability to glide freely through the surrounding tissues after hours of compression and stillness overnight. You may have heard of nerve flossing before. In video 4, I showed you a seated version. This is the lying down version, which is gentler, more controlled, and ideal for the morning when the nerve is at its most sensitive and irritated. Here is how to do it. Lie flat on your back with both legs extended straight. Take a moment to breathe slowly and let your body relax into the mattress. Now gently bend your right knee and bring it toward your chest. Hold the back of your thigh with both hands just above the knee. Your knee is bent at roughly 90 degrees. Your lower leg is hanging relaxed. From this position, slowly straighten your knee, extending your leg toward the ceiling as far as you comfortably can. As you straighten your knee, simultaneously flex your foot. Pull your toes back toward your shin. Hold for 2 seconds at the end of your comfortable range. You should feel a gentle pulling sensation running down the back of your leg. That is the sciatic nerve being gently mobilized. Then slowly bend your knee back and simultaneously point your toes away from you. Plantar flexion. Return to the bent knee starting position. Hold for 2 seconds. That is 1 repetition. The straightening and foot flexion phase gently tensions the nerve. The bending and pointing phase releases it. This alternating tension and release is what creates the flossing effect. The nerve is gently moved through its surrounding tissues, breaking up overnight adhesions and restoring its ability to glide freely. Do 10 repetitions on the affected side. nice and slow. The slower you go, the more effective this technique is. If you experience a sharp shooting pain during this exercise, reduce your range of motion significantly. You should feel a gentle stretch or pulling sensation, not sharp pain. Work within a range that feels like a gentle mobilization, not an aggravation. After completing 10 repetitions on the affected side, do 5 gentler repetitions on the unaffected side. This maintains symmetry and prevents the unaffected side from becoming restricted over time. What this exercise is doing in the context of your morning routine is critical. Before you do any other movement, you are restoring the sciatic nerve's ability to move freely. Every subsequent exercise in this routine will be more effective because the nerve can now glide as it should, rather than being restricted by overnight adhesions. Exercise 2, Figure 4, Piriformis Release. The second exercise targets the piriformis muscle, that small but powerful muscle deep in your buttock that sits directly on top of the sciatic nerve, or in some people directly around it. As we covered in Video 3 and Video 4, the piriformis is one of the most common sources of sciatic nerve compression. It becomes chronically tight and shortened through years of prolonged sitting, inactivity, and the gradual muscle imbalances that develop after 50. And after a full night of sleep in a fixed position, the piriformis is at its tightest and most compressed. Releasing it before you stand up prevents the piriformis from immediately compressing the sciatic nerve the moment you start walking. Here is how to do it lying in your bed. Lie on your back with both knees bent and feet flat on the mattress. Cross your right ankle over your left knee so that your right foot is resting on your left thigh. Your right knee is pointing out to the side. This is the Figure 4 position. Now gently flex your right foot. Pull the toes back toward your shin. This increases the stretch in the piriformis slightly. You have 2 options for deepening the stretch. Option 1. Simply hold this position and let gravity and the weight of your leg create a gentle stretch in the right buttock. Option 2. Reach both hands through the gap between your legs and interlace your fingers behind your left thigh. Gently pull your left thigh toward your chest. This increases the stretch in the right piriformis significantly. Hold the stretch for 30 to 60 seconds. Breathe slowly and deeply. With each exhale consciously, try to release the tension in your right buttock and let the stretch deepen slightly. You should feel a deep aching stretch in the buttock of the crossed leg. This is the piriformis muscle being stretched. For many people with sciatica caused by piriformis syndrome, this stretch will produce a familiar sensation, the same tight aching feeling they get in their buttock throughout the day. That recognition is actually a good sign. It confirms that the piriformis is involved in your sciatica and that this stretch is addressing the right structure. After 30 to 60 seconds, slowly uncross your leg and repeat on the left side. Even if your sciatica is only on one side, spend time on both sides every morning. Tightness on the non-symptomatic side contributes to pelvic imbalance that can aggravate the symptomatic side. Do 2 holds of 30 to 60 seconds on each side every morning. Exercise 3, supine knee to opposite shoulder. The third exercise builds on the Figure 4 stretch and targets a slightly different set of structures. While the Figure 4 primarily targets the piriformis, this exercise targets the entire external rotator group of the hip, a collection of 6 small muscles that sit deep in the buttock alongside the piriformis and that collectively form a dense muscular layer through which the sciatic nerve must pass. When this entire group is tight and restricted, which is extremely common after 50, the sciatic nerve is squeezed from multiple directions simultaneously. This exercise releases all of them with one movement. Here is how to do it. Lie on your back. Bring your right knee up toward your chest. Now, instead of pulling the knee straight up toward the ceiling, pull it across your body toward your left shoulder. Use both hands to guide your knee gently across. Keep your lower back as relaxed as possible against the mattress. Keep your shoulders flat on the mattress and do not let your right shoulder lift up. You should feel a deep stretch in the outer hip and buttock of your right side, deeper and in a slightly different location than the Figure 4 stretch. Some people describe it as feeling like a stretch deep inside the hip socket. Hold for 30 to 60 seconds. Breathe slowly. With each exhale, allow the knee to come a little closer to the opposite shoulder. Then slowly return to the starting position and repeat on the left side. 2 holds of 30 to 60 seconds on each side. Now I want to point out something important about this exercise specifically. For people whose sciatica is caused by spinal stenosis, the narrowing of the spinal canal, this movement provides particular relief. The knee to opposite shoulder position gently flexes the lumbar spine and opens the spaces in the spinal canal through which the nerve roots pass. For people who experience relief when sitting or bending forward, this is the mechanism at work, and doing it in the morning before standing up maximizes the benefit before the canal is placed under gravitational load. Exercise 4. Sciatic nerve tension release with ankle circles. The fourth exercise is one that most people have never seen in a sciatica routine, and it is one that consistently surprises my patients with how much relief it provides. It targets the sciatic nerve at its most distal point in the foot and ankle and uses gentle movement at the far end of the nerve to create a mobilizing effect that travels all the way up the nerve pathway to the point of compression in the lower back or buttock. Think of the sciatic nerve like a long rope. If you hold one end of the rope and gently move the other end, the movement travels along the entire length of the rope. This exercise uses the same principle. By gently moving the foot and ankle, you create a gentle mobilizing wave that travels up the entire sciatic nerve from foot to spine. Here is how to do it. Lie flat on your back with both legs extended. Straighten your right leg completely. Flex your right foot gently. Pull your toes back toward your shins so the nerve is on mild tension. Hold this gentle tension throughout the exercise. Now slowly rotate your ankle in large, slow circles. 10 circles clockwise, then 10 circles counterclockwise. Keep the movement slow and smooth. Keep the foot gently flexed throughout. The tension in the foot is what transmits the mobilizing effect up the nerve. You may feel a gentle pulsing or movement sensation running up the back of your leg as you do this. That is the sciatic nerve being gently mobilized from the distal end. This is exactly what you want to feel. Do 10 circles in each direction on the affected side, then 5 circles in each direction on the unaffected side. This exercise is particularly effective for people who experience numbness, tingling, or burning sensations in the foot or lower leg, symptoms that indicate the sciatic nerve is being compressed significantly enough to affect sensation at the nerve's most distal branches. The distal mobilization helps restore nerve signal conduction and reduces the numbness and tingling over time with consistent daily practice. Exercise 5. Supported lumbar decompression. The fifth and final exercise in this morning routine is the one I want you to finish with every single day. It is both a passive decompression and a gentle mobilization, and it is the perfect way to transition from the bed exercises to standing up and starting your day. Here is how to do it. Lie on your back. Pull both knees up and plant your feet flat on the mattress hip width apart. Your knees are bent at approximately 90 degrees. Now place a firm pillow or a folded blanket under your lower back, in the curve between your lower back and the mattress. The support should be positioned at the level of your lower back, roughly at the level of your belt line. It should be firm enough to provide support but not so thick that it forces your lower back into an uncomfortable arch. 2 to 3 inches of height is usually ideal. With this support in place, let your body completely relax. Release all muscle tension. Let your lower back sink gently into the support. Close your eyes and take 5 slow, deep breaths. With each breath in, allow your chest and ribcage to expand. With each breath out, consciously release any remaining tension in your lower back, buttocks, and legs. Hold this supported position for 2 to 3 minutes. What is happening here is subtle but extremely powerful. The supported position gently opens the facet joints of the lumbar spine. It creates space in the foramina, the openings through which the nerve roots exit the spine. The deep breathing creates a gentle pressure change inside the abdominal cavity with each breath that produces a very subtle pumping motion in the lumbar spine. And the complete muscle relaxation allows the structures around the sciatic nerve to decompress passively. After 2 to 3 minutes of this supported decompression, slowly remove the pillow. Bring your knees to your chest briefly, 5 seconds, then roll to your side. Pause on your side for 5 to 10 seconds. Then slowly push yourself up to sitting using your arms. Take a moment sitting on the edge of the bed before you stand. This transition, from lying to side lying to sitting to standing, is critically important for sciatica sufferers. The abrupt morning stand, swinging both legs off the bed and immediately bearing full weight, is one of the most common triggers for acute sciatica flare-ups. The slow graduated transition gives your spine time to adjust to the change in load incrementally. Let me give you the complete routine in sequence so you can follow it every morning without having to remember the details. Start all of these before getting out of bed. Keep a firm pillow nearby for exercise 5. Exercise 1. Supine sciatic nerve floss. 10 repetitions on the affected side, 5 on the unaffected side, 2 seconds at each end of the range. Total time approximately 3 minutes. Exercise 2, Figure 4, piriformis release. 2 holds of 30 to 60 seconds on each side. Total time approximately 3 to 4 minutes. Exercise 3, knee to opposite shoulder. 2 holds of 30 to 60 seconds on each side. Total time approximately 3 to 4 minutes. Exercise 4, ankle circles with nerve tension. 10 circles in each direction on the affected side. 5 in each direction on the unaffected side. Total time approximately 2 minutes. Exercise 5, supported lumbar decompression. 2 to 3 minutes of passive decompression followed by the slow graduated transition to standing. Total time approximately 4 to 5 minutes. Total routine time approximately 15 minutes. Do this every single morning, every morning without exception. The consistency of doing this every day is far more important than doing it perfectly. An imperfect routine done I want to be honest with you about the timeline because I think honesty about this is one of the most important things I can give you. In the first 3 to 5 days, you are primarily learning the movements and getting your body used to the routine. Some people feel immediate relief after their very first session, particularly from the piriformis release and the nerve floss. Others feel minimal change in the first few days. Both are normal. In the first 2 weeks, most people begin to notice that their morning pain is either less intense or takes less time to settle after getting up. The sciatic nerve is becoming more mobile. The piriformis is beginning to release its chronic tension. The morning flare-ups are becoming less severe. Between 2 and 4 weeks, the majority of my patients who follow this routine consistently report a meaningful reduction in their morning sciatica symptoms. Some report that their symptoms have reduced significantly throughout the entire day, not just the morning, because the nerve begins the day in a less irritated and less compressed state. Beyond 4 weeks for many people, this routine becomes the most effective single intervention they have found for their sciatica. The cumulative daily decompression and mobilization creates lasting changes in the tissue around the sciatic nerve. The piriformis develops a new normal length. The nerve develops a new normal level of mobility. I have patients who have been doing this routine every morning for over a year. They tell me it has become as automatic as brushing their teeth, and they tell me that on the rare mornings when they skip it, they feel the difference immediately. That is the goal, to make this so automatic and so clearly beneficial that skipping it feels wrong. I want to briefly address how this routine fits with the other videos in this channel because I know many of you are watching multiple videos and want to know how to put it all together. This morning bed routine from today's video is your first layer. Do it before you get out of bed every morning. Once you are up and moving, the morning floor routine from video 2 is your second layer. The cat-cow, the glute bridge, the bird dog, those exercises build strength and mobility on top of the foundation this routine creates. The deep stabilizer protocol from video 5, the abdominal brace, the multifidus activation, the dead bug, the side plank is your third layer. Do those in the evening as a separate 5 to 10 minute session. And throughout the day, apply the sitting habits from video 4, breaking up your sitting every 45 minutes, supporting your lower back when seated, avoiding prolonged standing without movement. These 4 layers together form the most complete daily management approach for sciatica that I can offer you through this channel. Each layer addresses a different aspect of the problem, and together they create a comprehensive daily practice that attacks sciatica from every direction simultaneously. Let me wrap this up simply. Every morning before you get out of bed, do these 5 exercises in this order. Exercise 1, supine sciatic nerve floss, 10 repetitions on the affected side, restores nerve mobility after overnight compression. Exercise 2, Figure 4, piriformis release, 2 holds each side, releases the muscle most commonly compressing the sciatic nerve. Exercise 3, knee to opposite shoulder, 2 holds each side, releases the entire external rotator group and opens the spinal canal for stenosis sufferers. Exercise 4, ankle circles with nerve tension, 10 circles each direction on affected side, mobilizes the nerve from its distal end, creating a mobilizing wave up the entire nerve pathway. Exercise 5, supported lumbar decompression, 2 to 3 minutes, passively opens the lumbar spine and creates the optimal conditions for the nerve to decompress before you stand. Then transition slowly, roll to your side, sit up using your arms, pause before standing. Do this every morning, give it 2 weeks of consistency, and pay attention to how your mornings change. because waking up and immediately feeling that familiar shooting pain down your leg does not have to be the first experience of your day, and with the right preparation, it does not have to be. If this routine helps you, I genuinely want to hear about it. Comment below and tell me where you are watching this from and which exercise made the biggest difference for you in the first week. Those comments not only mean the world to me, they help other people watching this video know what to focus on. Please hit the like button if this was helpful and subscribe to the channel so you never miss a new video. Every single week I put out new content designed specifically to help Americans over 50 understand their back and take real control of their pain. See you in the next video here on the channel.